As a specialist in men's sexual health, I want to begin with a reality that many men over the age of 60 quietly face but rarely discuss. The earliest signs of aging are not always visible in the hair or joints. Gray hair, knee stiffness, or the need for reading glasses are superficial indicators. The true biological marker of aging in men often appears in the vascular system, specifically in the microcirculation of the genital region. This is the area where blood flow must be rapid, flexible, and responsive. When circulation begins to falter, men notice a constricted sensation, reduced responsiveness, and a slower physiological reaction during intimacy. These changes are not simply psychological, nor are they solely related to hormones. They are vascular in origin. From a clinical perspective, the small arteries and arterioles, often thinner than a strand of hair, are the first to demonstrate age-related rigidity. These microvessels are responsible for delivering oxygenated blood to delicate tissues. When they lose elasticity, the result is impaired perfusion, reduced sensitivity, and diminished erectile response. This phenomenon is known as endothelial dysfunction, a condition where the inner lining of blood vessels, the endothelium, fails to regulate vascular tone effectively. Endothelial dysfunction is a precursor to broader cardiovascular disease, and its earliest manifestation is often seen in the male genital circulation. Patients frequently misinterpret these changes as a decline in testosterone or libido. However, clinical studies demonstrate that in many cases, hormone levels remain within normal ranges, while vascular health deteriorates. The inability of vessels to dilate properly during arousal leads to the sensation of tightness, sluggishness, and reduced firmness. Under the microscope, these vessels resemble a kinked garden hose. Blood attempts to flow, but the pathway is restricted. This restriction is not due to lack of desire, but due to impaired nitric oxide signaling and vascular rigidity. Nitric oxide, NO, is a critical molecule produced by endothelial cells. It acts as a vasodilator, relaxing smooth muscle in vessel walls and allowing blood to flow freely. In younger men, nitric oxide production is abundant, ensuring rapid vascular response. However, by the age of 60, nitric oxide levels can decline by up to 50%. This reduction alone is sufficient to cause delayed response, pressure sensations, and diminished erectile quality. Without adequate nitric oxide, vessels cannot relax, and tissues cannot engorge with blood as they once did.
Consider the case of Robert, a 68-year-old retired truck driver. His clinical presentation was typical: normal hormone levels, preserved libido, but impaired vascular response. Years of sedentary work, high sodium intake, fluctuating blood sugar, and dehydration had gradually eroded his endothelial function. His microvessels exhibited early rigidity, a hallmark of vascular aging. Importantly, Robert was not broken. His cardiovascular system was not failing entirely. Rather, his vessels were fatigued, constricted, and in need of targeted support. This is where nutritional interventions become clinically relevant. Certain foods contain bioactive compounds that directly enhance nitric oxide production, relax vascular smooth muscle, and provide essential minerals for tissue function. These interventions are not pharmaceutical shortcuts. They are physiological supports that restore natural processes. Beetroot, Beta vulgaris, is one of the most potent dietary sources of nitrates. Once ingested, nitrates are converted into nitric oxide via the nitrate-nitrite-no pathway. Clinical trials have demonstrated that beetroot juice can significantly increase plasma nitric oxide levels within hours, improving endothelial function and reducing blood pressure. For older men, even a small daily dose of beetroot juice, approximately 120 milliliters, can restore vascular responsiveness. Patients often report reduced groin tightness, improved warmth in extremities, and enhanced erectile quality within weeks. This is not a placebo effect, it is the direct biochemical action of nitric oxide on vascular smooth muscle. Another overlooked food is watermelon, Citrullus lanatus, particularly the white rind. The rind contains high concentrations of the amino acid citrulline, which the body converts into arginine, a precursor for nitric oxide synthesis. Unlike beetroot, which signals vessels to open, citrulline reduces vascular tension by relaxing smooth muscle. This dual mechanism, beetroot increasing nitric oxide, watermelon rind reducing vascular stress, creates a synergistic effect. Together, they restore both the signal and the pathway for blood flow. Clinical studies confirm that citrulline supplementation improves erectile function scores in men with mild vascular dysfunction. Finally, pumpkin seeds, cucurbita pepo, provide essential minerals such as magnesium, zinc, and arginine. Magnesium relaxes vascular smooth muscle, reducing the cramping sensation many men describe.
When we examine male sexual health clinically, one of the most overlooked truths is that erectile decline is not primarily hormonal, it is vascular. Testosterone levels may fluctuate with age, but the majority of men in their 60s and 70s still maintain adequate hormonal signaling. What fails them is circulation. The genital region is uniquely dependent on rapid microvascular dilation. Unlike larger arteries that supply the heart or brain, penile arteries are extremely small, often less than 1 to 2 millimeters in diameter. This makes them the first vessels to reveal systemic vascular disease. In fact, erectile dysfunction is now considered an early warning sign of cardiovascular disease. Studies show that men who develop erectile difficulties often experience cardiac events within 3 to 5 years if vascular health is not addressed. This is why sexual health specialists emphasize that intimacy problems are not isolated. They are systemic. When blood vessels lose elasticity, the consequences extend beyond the bedroom. Men report fatigue, reduced stamina, mood changes, and metabolic slowdown. These are all linked to impaired endothelial function. The endothelium is the thin layer of cells lining blood vessels. It produces nitric oxide, regulates vascular tone, and controls inflammation. With age, oxidative stress, poor diet, and sedentary lifestyle damage the end. Once nitric oxide production declines, besettis, cystifun, blood pressure rises, and erectile response weakens. Lifestyle factors accelerate this decline. High sodium diets increase vascular stiffness. Chronic stress elevates cortisol, which damages endothelial cells. Poor sleep reduces testosterone and growth hormone, both of which support vascular repair. Smoking introduces free radicals that destroy nitric oxide molecules before they can act. Excess alcohol dehydrates tissues and impairs smooth muscle relaxation. Each of these factors contributes to the sensation men describe as tightness or sluggishness during arousal. From a therapeutic standpoint, the first step is education. Men must understand that their symptoms are not a loss of masculinity, but a biological signal. The body is communicating that circulation is impaired. Ignoring this message risks not only sexual health, but cardiovascular health. As specialists, we encourage men to view erectile changes as an opportunity to intervene early. By restoring vascular health, they not only regain intimacy but also protect their heart, brain, and metabolism. Nutritional interventions are powerful because they act directly on the biochemical pathways involved. Beetroot, watermelon rind, and pumpkin seeds are not exotic supplements. They are accessible foods with clinically proven effects. Beetroot increases nitric oxide, watermelon rind reduces vascular tension, and pumpkin seeds provide essential minerals. Together, they form a triad that addresses signal, pathway, and foundation. But food alone is not enough. Exercise is critical. Aerobic activities such as brisk walking, cycling, or swimming increases endothelial nitric oxide synthase, the enzyme responsible for nitric oxide production. Resistance training improves testosterone signaling and muscle mass, both of which support vascular health. Pelvic floor exercises, often overlooked, strengthen the muscles that maintain rigidity during erection. Clinical trials show that men who perform pelvic floor training experience significant improvements in erectile function compared to those who rely solely on medication. Hydration is another underestimated factor. Blood is primarily water. Dehydration thickens blood, reduces flow, and increases vascular strain. Older men often drink less water, mistaking thirst for hunger. Encouraging patients to consume adequate fluids improves circulation and reduces the cramping sensation in the groin. Stress management is equally vital. Chronic stress elevates sympathetic nervous system activity, constricting blood vessels. Techniques such as mindfulness, breathing exercises, and yoga reduce vascular tension. Patients who adopt stress management protocols often report not only improved intimacy but better sleep, mood, and energy. Clinical screening is essential. Erectile dysfunction can be the first sign of hypertension, diabetes, or hyperlipidemia. Specialists recommend that men with new-onset erectile difficulties undergo cardiovascular evaluation, blood pressure measurement, fasting, glucose, and lipid profile can reveal underlying disease. Treating these conditions not only improves longevity but restores sexual health. Pharmacological options exist, such as phosphodiesterase type 5 inhibitors, for example. These drugs enhance nitric oxide signaling by preventing the breakdown of cyclic GMP, the molecule that mediates smooth muscle relaxation. However, medications are not curative. They provide temporary support but do not reverse endothelial dysfunction without lifestyle and nutritional interventions. Reliance on medication alone often leads to diminishing returns. This is why the integrative approach to exercise, hydration, stress management, and medical screening is the gold standard. It addresses root causes rather than symptoms. Men who adopt this approach often experience improvements within weeks. Warmth returns to extremities, groin tightness diminishes, and erectile response becomes more reliable. More importantly, they reduce the risk of heart attack and stroke. Consider Harold, a 70-year-old patient from Minnesota. He began drinking beetroot juice daily, added watermelon rind to smoothies, and consumed pumpkin seeds with breakfast. He also started walking 30 minutes each morning. Within 2 weeks, he reported improved energy, reduced groin pressure, and spontaneous morning erection. His blood pressure decreased, his mood improved, and his confidence returned. This case illustrates the synergy of nutritional and lifestyle interventions. The body retains its capacity for repair, even in advanced age, when given the right environment. The message is clear: sexual health is vascular health. Erectile decline is not inevitable. It is preventable, reversible, and treatable. Men must be educated to recognize the signs, adopt interventions, and seek medical evaluation. As specialists, Our role is to provide knowledge, guidance, and reassurance. Age does not mean loss of vitality. With proper care, men can maintain intimacy, confidence, and cardiovascular health well into their 70s and beyond. Beyond the foundational foods of beetroot, watermelon rind, and pumpkin seeds, sexual health specialists emphasize the importance of advanced nutrition. Erectile function is not sustained by one nutrient alone. It requires a network of biochemical supports. The vascular system thrives when antioxidants, omega-3 fatty acids, and polyphenols are consistently supplied. These compounds protect endothelial cells, reduce inflammation, and enhance nitric oxide signaling. Oxidative stress is one of the primary drivers of vascular aging. Free radicals damage the endothelium, impair nitric oxide synthesis, and stiffen vessel walls. This process is accelerated by smoking, high-fat diets, and chronic illness. Antioxidants neutralized free radicals, preserving endothelial integrity. Clinical studies show that diets rich in antioxidants improve erectile function scores and reduce cardiovascular risk. Foods such as blueberries, pomegranates, and dark leafy greens are particularly potent. Pomegranate juice, for example, has been shown to increase penile blood flow in men with mild erectile dysfunction. Due to its high polyphenol content, omega-3 fatty acids found in fish such as salmon and mackerel play a crucial role in reducing vascular inflammation. They lower triglycerides, improve endothelial function, and enhance blood flow. Men who consume omega-3 south regularly demonstrate better erectile performance and lower risk of cardiovascular disease. From a sexual health perspective, omega-3 south improve the fluidity of cell membranes, allowing nitric oxide to act more efficiently. They also reduce platelet aggregation, ensuring smoother blood flow through microvessels. Polyphenols, abundant in foods like green tea, cocoa, and red grapes, act as natural vasodilators. They stimulate endothelial nitric oxide synthase, the enzyme responsible for nitric oxide production. Cocoa flavonols, in particular, have been studied for their ability to improve penile blood flow. Men who consume high flavanol cocoa demonstrate improved erectile rigidity and reduced vascular resistance. These findings highlight the importance of dietary. A man who combines beetroot, watermelon rind, pumpkin seeds, omega-3 south, and polyphenols creates a biochemical environment where vessels remain flexible, responsive, and resilient. Another critical nutrient is vitamin D. Deficiency in vitamin D is common among older men and is associated with endothelial dysfunction. Vitamin D receptors are present in vascular tissue and adequate levels support nitric oxide production. Clinical trials show that supplementation improves erectile function in men with low vitamin D sunlight exposure. Fortified foods and supplements are practical ways to restore levels. Magnesium, already highlighted in pumpkin seeds, deserves further emphasis. It is a cofactor in over 300 enzymatic reactions, many of which regulate vascular tone. Low magnesium levels increase vascular stiffness and blood pressure. Supplementation improves endothelial function and reduces the sensation of groin tightness. Specialists often recommend magnesium-rich foods such as spinach, almonds, and avocados. In addition to pumpkin seeds, zinc, another mineral found in pumpkin seeds, supports testosterone receptor activity. While testosterone levels may remain stable, receptor sensitivity declines with age. Zinc restores this sensitivity, ensuring hormonal signals are properly received. This is why zinc deficiency often manifests as reduced libido and erectile difficulties. Clinical supplementation studies confirm that restoring zinc improves sexual desire and erectile quality. Arginine and amino acids central to nitric oxide production can be obtained from both food and supplements. Arginine is abundant in nuts, seeds, and legumes. Citrulline, as noted, is concentrated in watermelon rind. Together, they form the substrate and precursor for nitric oxide synthesis. Supplementation with these amino acids has been shown to improve erectile function, particularly in men with mild vascular impairment. From a clinical standpoint, advanced nutrition is not about isolated supplements, but about synergy. Each nutrient supports a different aspect of vascular health. Antioxidants protect the endothelium. Omega-3 reduce inflammation. Polyphenols stimulate nitric oxide production. Minerals restore receptor sensitivity. Amino acids provide substrates for nitric oxide synthesis. When combined, they create a comprehensive nutritional protocol that addresses both prevention and treatment. Lifestyle integration is key. Patients often ask whether they must adopt strict diets. The answer is no. Small, consistent changes yield significant results. A glass of beetroot juice in the morning, a handful of pumpkin seeds in the afternoon, grilled salmon twice a week, and a cup of green tea daily create a powerful foundation. These habits are sustainable, enjoyable, and clinically effective. Consider Bill, a 67-year-old Navy veteran. He presented with vascular stress, describing his body as tightening rather than opening during arousal. His hormone levels were normal, but his endothelial function was impaired. We introduced a protocol: beetroot juice, watermelon rind, smoothies, pumpkin seeds, omega-3 fish twice weekly, and daily green tea. Within 3 weeks, Bill reported reduced groin pressure, improved erectile rigidity, and enhanced vitality. His blood pressure decreased, his mood improved, and his confidence returned. This case illustrates the power of advanced nutrition in restoring sexual health. The broader message is that sexual health is inseparable from systemic health. Erectile function reflects vascular integrity. By adopting advanced nutrition, men not only regain intimacy, but also protect their heart, brain, and metabolism. This integrative approach is the cornerstone of sexual health practice. It empowers men to take control of their health, restore confidence, and maintain vitality well into later life. When discussing male sexual health, hormones inevitably enter the conversation. Testosterone is the central hormone associated with male vitality, libido, and erectile function. However, as specialists, we emphasize that testosterone is only one piece of the puzzle. Erectile performance depends on the interplay between hormonal signaling and vascular health. Without proper circulation, even optimal testosterone levels cannot produce reliable erection. Conversely, without adequate hormonal signaling. Vascular health alone cannot sustain desire and responsiveness. Testosterone production occurs primarily in the testes, regulated by the hypothalamic pituitary gonadal HPG axis. The hypothalamus releases gonadotropin-releasing hormone GnRH, which stimulates the pituitary gland to secrete luteinizing hormone LH. LH then signals the testes to produce testosterone. With age, this axis becomes less efficient. Testosterone levels decline gradually, a phenomenon known as latent set hypogonadism. Symptoms include reduced libido, fatigue, mood changes, and decreased muscle mass. However, not all men experience clinically significant declines. Many maintain adequate levels well into their 70s. The challenge lies in receptor sensitivity. Testosterone must bind to androgen receptors in tissues to exert its effects. With age, receptor responsiveness diminishes. This means that even normal testosterone levels may not produce the same physiological outcomes. Zinc, as discussed earlier, plays a critical role in restoring receptor sensitivity. Without adequate zinc, receptors remain sluggish and hormonal signals are blunted. Another factor is sex hormone binding globulin SHBG. SHBG binds testosterone in the bloodstream, reducing the amount of free bioavailable hormone. With age, SHBG levels rise, further limiting testosterone activity. This explains why some men with normal total testosterone still experience symptoms of deficiency. Clinically, measuring free testosterone provides a more accurate assessment of hormonal status. Testosterone interacts directly with vascular health. It stimulates nitric oxide synthase, enhancing nitric oxide production. It also supports the growth and maintenance of smooth muscle in penile tissue. Low testosterone contributes to endothelial dysfunction, reduced nitric oxide, and impaired erectile response. Conversely, restoring testosterone improves vascular function. This is why men with hypogonadism often experience both reduced libido and erectile difficulties. However, testosterone therapy is not a universal solution. While replacement can benefit men with clinically low levels, it carries risks. Excessive supplementation may increase red blood cell count, raising the risk of clotting. It can also exacerbate prostate enlargement. Therefore, therapy must be carefully monitored with blood tests and clinical evaluation. Specialists emphasize that lifestyle interventions, nutrition, exercise, stress management often restore hormonal balance naturally without the need for medication. Exercise is particularly effective. Resistance training increases testosterone production by stimulating the HPG axis. Aerobic activity reduces SHBG, increasing free testosterone. Weight loss improves insulin sensitivity, which enhances hormonal signaling. Sleep is equally critical. Testosterone is produced during deep sleep. Men who sleep less than 6 hours per night often exhibit significantly lower levels. Restoring sleep hygiene can dramatically improve hormonal health. Stress management also plays a role. Chronic stress elevates cortisol, which suppresses testosterone production. High cortisol levels interfere with GnRH release, disrupting the HPG axis. Techniques such as meditation, breathing exercises, and yoga reduce cortisol allowing testosterone production to normalize. Patients who adopt stress management protocols often report improved libido, energy, and erectile function. Nutritional support is essential. Zinc, magnesium, and vitamin D all enhance testosterone production and receptor sensitivity. Healthy fats, particularly omega-3 south, provide the cholesterol backbone required for hormone synthesis. Antioxidants protect Leydig cells in the testes from oxidative damage. Together, these nutrients create an environment where testosterone can be produced, circulated, and utilized effectively. Consider the case of Ahmed, a 65-year-old patient. He presented with reduced libido, fatigue, and erectile difficulties. His total testosterone was within normal range, but his free testosterone was low due to elevated SHBG, his zinc levels were deficient, and his sleep was fragmented. We introduced a protocol, zinc supplementation through pumpkin seeds, magnesium-rich foods, improved sleep hygiene, and stress reduction technique. Within 2 months, Ahmed reported restored libido, improved energy, and more reliable erection. His free testosterone increased and his SHBG decreased. This case illustrates the importance of addressing hormonal health holistically rather than relying solely on medication. The broader message is that testosterone is not an isolated hormone. It interacts with vascular health, metabolism, and psychological well-being. Erectile function depends on this interplay. Specialists emphasize that men must support both hormonal and vascular systems simultaneously. Beetroot, watermelon rind, and pumpkin seeds restore circulation. Zinc, magnesium, and vitamin D restore hormonal signaling. Exercise, sleep, and stress management optimize production. Together, these interventions create a comprehensive protocol for sexual vitality. Ultimately, the decline in sexual health with age is not inevitable. It is the result of modifiable factors: vascular rigidity, hormonal imbalance, lifestyle stressors. By addressing these factors, men can maintain intimacy, confidence, and vitality well into later life. The role of the specialist is to provide knowledge, guidance, and reassurance. Age does not mean loss of masculinity. With proper care, men can remain vibrant, responsive, and connected. When men experience changes in sexual performance, the physical aspects are only part of the story. As specialists, we recognize that psychological health, partner, communication, and confidence play equally important roles. Erectile function is a complex interaction of vascular physiology, hormonal signaling, and neurological pathways, but it is also deeply influenced by mental state. Anxiety, stress, and relationship dynamics can amplify physical symptoms, creating a cycle of worry and reduced performance. One of the most common psychological patterns we see is performance anxiety. A man experiences one episode of erectile difficulty and immediately begins to fear recurrence. This fear activates the sympathetic nervous system, releasing adrenaline. Adrenaline constricts blood vessels, directly opposing the relaxation required for erection. Thus, anxiety itself becomes a physiological barrier. Breaking this cycle requires reassurance, education, and communication. Partner communication is critical. Many men suffer in silence, fearing judgment or rejection. Yet studies show that when men openly discuss their concerns with partners, outcomes improve dramatically. Partners often respond with empathy and support, reducing anxiety and restoring intimacy. Specialists encourage couples to view erectile changes not as failure, but as a shared health challenge. This reframing reduces shame and fosters collaboration. Confidence is another key factor. Sexual confidence is built on trust in one's body. When circulation falters, confidence erodes. Men begin to doubt themselves, which further impairs performance. Restoring confidence requires both physical and psychological interventions. Nutritional protocols, exercise, and medical screening rebuild the body. Counseling, mindfulness, and communication rebuild the mind. Together, they restore the sense of competence and masculinity. Depression and stress also play roles. Depression reduces libido, energy, and motivation. Stress elevates cortisol, which suppresses testosterone and constricts vessels. Addressing these conditions is essential. Cognitive behavioral therapy, CBT, has been shown to improve sexual function by reducing negative thought patterns. Mindfulness meditation reduces stress, enhances body awareness, and improves erectile reliability. Patients who adopt these practices often report not only improved intimacy, but better overall quality of life. Neurological health must also be considered. Erections are mediated by parasympathetic nerve activity. Conditions such as diabetes, multiple sclerosis, and spinal injury impair nerve signaling. Psychological support helps men adapt to these challenges, while medical interventions address underlying disease. Specialists emphasize that erectile difficulties are not simply in the head. They are real physiological conditions that require comprehensive care. Case studies illustrate the importance of psychological support. John, a 62-year-old patient, experienced erectile difficulties after retirement. Physically, his vascular health was adequate, but psychologically, he felt a loss of identity and purpose. His confidence eroded and intimacy suffered. Through counseling, exercise, and nutritional support, John regained vitality. His erections improved, but more importantly, his sense of self was restored. This case highlights the interplay between mind and body. Partner involvement enhances outcomes. Couples who engage in therapy together report higher satisfaction. Techniques such as sensei-focused exercises reduce pressure and rebuild intimacy gradually. These exercises emphasize touch, connection, and relaxation rather than performance. By shifting focus from outcome to experience, couples rediscover pleasure and reduce anxiety. Sexual confidence is also influenced by education. Many men believe erectile decline is inevitable. When specialists explain the vascular and hormonal mechanisms, men realize that recovery is possible. This knowledge itself restores hope and confidence. Patients often say, "I thought I was too old, but now I understand my body can heal." Education transforms perception, which transforms performance. Ultimately, sexual health is holistic. It requires attention to body, mind, and relationship. Vascular protocols restore circulation. Hormonal support restores signaling. Psychological care restores confidence. Partner communication restores connection. Together, these elements create a comprehensive framework for vitality. The broader message is that intimacy is not lost with age. It evolves. With proper care, men can maintain responsiveness, confidence, and connection well into later life. Specialists emphasize that sexual health is not only about it is about identity, self-esteem, and partnership. Addressing psychological aspects ensures that physical interventions succeed. Without confidence and communication, even the best medical protocols fall short. With them, recovery becomes complete. Long-term sexual vitality requires more than short-term fixes. As specialists, we emphasize prevention, sustainability, and integration. Erectile function is a sensitive barometer of overall health. When circulation falters, hormones weaken, or confidence erodes. The body is signaling deeper imbalances. Addressing these signals early prevents progression to cardiovascular disease, metabolic syndrome, or severe hypoglycemia. The goal is not only recovery but resilience. Prevention begins with vascular health. Microvessels must remain elastic, responsive, and nourished. Daily habits are the foundation. Consistent intake of nitrate-rich foods, such as beetroot, maintains nitric oxide levels. Citrulline from watermelon rind reduces vascular tension. Minerals from pumpkin seeds restore tissue integrity. Adding antioxidants, omega-3 self, and polyphenols protects the endothelium from oxidative stress. These foods are not exotic. They are accessible, affordable, and clinically effective. The key is consistency. Small daily choices accumulate into long-term resilience. Exercise is equally critical. Aerobic activity enhances endothelial nitric oxide synthese, ensuring vessels respond rapidly. Resistance training boosts testosterone production and maintains muscle mass. Pelvic floor exercises strengthen the muscles that sustain rigidity. Together, these practices create a body that is metabolically efficient, hormonally balanced, and sexually responsive. Specialists recommend at least 150 minutes of moderate aerobic activity per week, combined with 2 sessions of resistance training. Even walking daily provides measurable benefits. Sleep is a cornerstone of prevention. Testosterone is produced during deep sleep. Growth hormone, essential for tissue repair, is also released at night. Men who consistently sleep less than 6 hours per night exhibit lower testosterone, higher cortisol, and impaired erectile function. Restoring sleep, hygiene, consistent bedtime, reduce screen exposure, and relaxation techniques improves hormonal balance and vascular health. Patients often report spontaneous morning erection returning once sleep is normalized. Stress management prevents chronic cortisol elevation. Cortisol suppresses testosterone and constricts vessels. Techniques such as mindfulness, meditation, and controlled breathing reduce sympathetic nervous system activity. Patients who adopt stress management protocols often experience improved libido, better erectile reliability, and enhanced mood. Stress reduction is not optional. It is a medical necessity for long-term sexual health. Medical screening ensures prevention is comprehensive. Erectile dysfunction can be the first sign of hypertension, diabetes, or hyperlipidemia. Specialists recommend regular blood pressure checks, fasting, glucose, and lipid profiles. Detecting and treating these conditions early prevents progression to cardiovascular disease. Men who view erectile changes as a health signal rather than a personal failure gain years of vitality and protection. Pharmacological support may be appropriate for some men. Phosphodiesterase type 5 inhibitors enhance nitric oxide signaling, providing immediate relief. Testosterone therapy may benefit men with clinically low levels. However, these interventions must be combined with lifestyle protocols. Medication alone does not reverse endothelial dysfunction. Without nutrition, exercise, sleep, and stress management, pharmacological effects diminish over time. Specialists emphasize integration rather than reliance. Psychological health must remain central. Confidence, communication, and identity are inseparable from sexual performance. Counseling, partner dialogue, and education restore trust and reduce anxiety. Men who understand the physiology of erectile function regain hope. Partners who engage in the process provide support and connection. Together, these elements transform recovery into resilience. Case studies illustrate prevention in action. Robert, a 72-year-old mechanic, adopted a protocol of beetroot juice, watermelon rind smoothies, pumpkin seeds, omega-3 fish, resistance training, and mindfulness meditation. Within months, his erectile function improved, his blood pressure normalized, and his confidence returned. More importantly, he prevented progression to cardiovascular disease. His story demonstrates that prevention is not abstract. It is practical, achievable, and transformative. The broader message is clear. Sexual health is systemic health. Erectile function reflects vascular integrity, hormonal balance, psychological confidence, and lifestyle resilience. Age does not mean inevitable decline. With proper care, men can maintain intimacy, vitality, and connection well into later life. Specialists emphasize that recovery is possible, prevention is powerful, and resilience is achievable. In conclusion, the path to long-term sexual vitality involves nutrition, beetroot, watermelon rind, pumpkin seeds, antioxidants, omega-3s, polyphenols, exercise, aerobic activity, resistance training, pelvic floor strengthening, sleep, restoring deep sleep for hormonal and vascular repair, stress management, reducing cortisol through mindfulness and relaxation medical screening, detecting and treating hypertension, diabetes, and lipid disorders, psychological support, building confidence, communication, and identity. Together, these elements form a comprehensive protocol. Men who adopt this approach experience not only improved erectile function but enhanced overall health. They regain confidence, protect their cardiovascular system, and maintain vitality. Sexual health is not lost with age. It evolves, strengthens, and endures when supported properly. The role of the specialist is to guide, educate, and reassure. With knowledge, consistency, and care, men can remain vibrant, responsive, and connected throughout their lives.